Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
A client reports having thoughts of being followed by foreign agents who are after his secret papers. Which response by the nurse is most appropriate when responding to the client's disturbed thought process? 1. I don't see any foreign agents. 2. I think these thoughts are frightening to you. 3. I don't know what you mean. 4. I'd like you to come to group with me right now. The correct answer is 2. The client's disturbed thought process likely reflects this client's paranoid delusions. The nurse should acknowledge that the thoughts are frightening the client. Telling the client the nurse does not see any foreign agents is an appropriate nursing response if the client is having disturbed visual sensory perception and is having visual hallucinations. Telling the client the nurse does not understand what the client means is an appropriate response if the client has impaired verbal communication. Suggesting that a client participate in group activities would be appropriate if the client had a nursing diagnosis of social isolation and was staying in his room. A client who is neatly dressed and clutching a leather briefcase tightly in his arms scans the adult inpatient unit on his arrival at the hospital and backs away from the window. The client requests that the nurse move away from the window. The nurse recognizes that doing as the client requested is contraindicated for which of the following reasons? 1. The action will make the client feel that the nurse is humoring him. 2. The action indicates nonverbal agreement with the client's false ideas. 3. The client will then think that he will have his way when he wishes. 4. The nurse will be demonstrating a lack of composure over the situation. The correct answer is 2. The nurse's nonverbal behavior, moving away from the window as the client requests, indicates agreement with the client's false ideas. The client's behavior is likely to be reinforced if the nurse takes steps to agree with the false ideas the client holds. A client is becoming agitated during a discussion group. She states, I know that all of you hate me. She leaves the group and goes to her room. Which action by the nurse is most therapeutic for the client? 1. After group, ask the client to talk to the nurse about her concerns. 2. Ask the client to return to group and share her feelings. 3. Explain to group members about the client's problems. 4. Ask the group members to apologize to the client individually. The correct answer is 1. It is appropriate to talk alone with this client about her feelings. A suspicious client is unlikely to agree to talk about feelings in a group. It is a violation of the client's privacy to reveal a client's problems to group members. The other clients in the group have no reason to apologize, and the nurse should not ask them to do so. A young client diagnosed with paranoid schizophrenia is talking with a nurse. When I thought everyone was out to get me, I was staying in my apartment all the time. Now, I'd like to get out and do things again. What is the best initial response by the nurse? 1. With whom do you want to do things? 2. What activities did you enjoy in the past? 3. What kind of transportation do you use? 4. How much money can you spend? The correct answer is 2. Knowing the client's interests is the best place to begin to help the client re-socialize. Knowing with whom the client wishes to socialize, what transportation she has, or how much spending money she has may be relevant questions, but should be asked after the question concerning what activities the client enjoyed in the past. The nurse who is caring for a client with kidney failure notes that the client is dyspneic, and crackles are heard on auscultation of the lungs. Which additional signs/symptoms should the nurse expect to note in this client? 1. Rapid weight loss. 2. Flat hand and neck veins. 3. A weak and thready pulse. 4. An increase in blood pressure. The correct answer is 4. Impaired cardiac or kidney function can result in fluid volume excess. Findings associated with fluid volume excess include cough, dyspnea, crackles, tachypnea, tachycardia, an elevated blood pressure, a bounding pulse, an elevated central venous pressure, weight gain, edema, neck and hand vein distension, an altered level of consciousness, and a decreased hematocrit level. The nurse should do which of the following actions first when admitting a multigravida client at 36 weeks gestation with a probable diagnosis of abruptio placentae? 1. Prepare the client for a vaginal examination. 2. Obtain a brief history from the client. 3. Insert a large gauge intravenous catheter. 4. Prepare the client for an ultrasound scan. The correct answer is 3. Abruptio placentae is a medical emergency because the degree of hypovolemic shock may be out of proportion to visible blood loss. On admission, the nurse should plan to first insert a large gauge intravenous catheter for fluid replacement and oxygen by mask to decrease fetal anoxia. Vaginal examination usually is not performed on pregnant clients who are experiencing third trimester bleeding due to abruptio placentae because it can result in damage to placenta and further fetal anoxia. The client's history can be obtained once the client has been admitted and the intravenous line has been started. The goal is birth of the fetus, usually by emergency cesarean section. The nurse should also plan to monitor the client's vital signs and the fetal heart rate. Ultrasound is of limited use in the diagnosis of abruptio placentae. Following a cesarean birth for abruptio placentae, a multigravida client tells a nurse, "I feel like such a failure. None of my other childbirths were like this." The nurse's response to the client is based on the understanding of which of the following? 1. The client will most likely have postpartum blues. 2. Maternal-infant bonding is likely to be difficult. 3. The client's feeling of grief is a normal reaction. 4. This type of birth was necessary to save the client's life. The correct answer is 3. Feelings of loss, grief, and guilt are normal after cesarean birth, particularly if it was not planned. The nurse should support the client, listen with empathy, and allow the client time to grieve. The likelihood of the client experiencing postpartum blues is not known, and no evidence is presented. Although maternal-infant bonding may be delayed owing to neonatal complications or maternal pain and subsequent medications, it should not be difficult. Although the nurse is aware that this type of birth was necessary to save the client's life, using this as the basis for the response does not acknowledge the mother's feelings. The primary health care provider prescribes whole blood replacement for a multigravida client with abruptio placentae. Before administering the intravenous blood product, the nurse should first 1. Validate client information and the blood product with another nurse. 2. Check the vital signs before transfusing over 5 to 6 hours. 3. Ask the client if she has ever had any allergies. 4. Administer 100 milliliters of 5% dextrose solution intravenously. The correct answer is 1. When administering blood replacement therapy, extreme caution is needed before administering any blood product. The nurse should validate the client information and the blood product with another nurse to prevent administration of the wrong blood transfusion. Although baseline vital signs are necessary, she should initiate the infusion of blood slowly for the first 10 to 15 minutes. Then, if there is no evidence of a reaction, she should adjust the rate of infusion to ensure that the blood product is infused over 2 to 4 hours. The nurse can ask the client if she has ever had a reaction to a blood product, but a general question about allergies may not elicit the most complete response about any reactions to blood product administration. Blood transfusions are typically given with intravenous normal saline solution, not dextrose solutions. When assessing a 34-year-old multigravida client at 34 weeks gestation experiencing moderate vaginal bleeding, which would follow would most likely alert the nurse that placenta previa is present. 1. Painless vaginal bleeding. 2. Uterine tetany. 3. Intermittent pain with spotting. 4. Dull lower back pain. The correct answer is 1. The most common assessment finding associated with placenta previa is painless vaginal bleeding. With placenta previa, the placenta is abnormally implanted, covering a portion or all of the cervical OS. Uterine tetany, intermittent pain with spotting, and dull lower back pain are not associated with placenta previa. Uterine tetany is associated with oxytocin administration. Intermittent pain with spotting commonly is associated with spontaneous abortion. Dull lower back pain is commonly associated with poor maternal posture or a urinary tract infection with renal involvement. When caring for a multigravida client admitted to the hospital with vaginal bleeding at 38 weeks gestation, Which of the following would the nurse anticipate administering intravenously if the client develops disseminated intravascular coagulation? 1. Ringer's lactate solution. 2. Fresh frozen platelets. 3. 5% dextrose solution. 4. Warfarin sodium. The correct answer is 2. Treatment of DIC includes treating the causative factor, replacing maternal coagulation factors, and supporting physiologic functions. Intravenous infusions of whole blood, fresh frozen plasma, or platelets are used to replace depleted maternal coagulation factors. Although Ringer's lactate solution and 5% dextrose solution may be used as intravenous fluid replacement, the client needs blood component therapy. Therefore, normal saline must be used. Intravenous heparin, not warfarin sodium, may be administered to halt the clotting cascade. A 24-year-old client, G3, P1, at 32 weeks gestation, is admitted to the hospital because of vaginal bleeding. After reviewing the client's history, which of the following factors might lead the nurse to suspect abruptio placentae? 1. Several hypotensive episodes. 2. Previous low transverse cesarean birth. 3. One induced abortion. 4. History of cigarette smoking. The correct answer is 4. Although the exact cause of abruptio placentae is unknown, possible contributing factors include excessive intrauterine pressure caused by hydramnios or multiple pregnancy, cigarette smoking, alcohol ingestion, trauma, increased maternal age and parity, and amniotomy. A history of hypertension is associated with an increased risk of abruptio placentae. A previous low transverse cesarean section and a history of one induced abortion are associated with increased risk of placenta previa, not abruptio placentae. The nurse is caring for a 22-year-old G2, P2 client who has disseminated intravascular coagulation after delivering a dead fetus. Which finding is the highest priority to report to the healthcare provider? 1. Activated partial thromboplastin time of 30 seconds. 2. Hemoglobin of 11.5 grams per deciliter. 3. Urinary output of 25 milliliters in the past hour. 4. Platelets at 149,000. The correct answer is 3. Urinary output of less than 30 milliliters per hour indicates renal compromise and would be the most important assessment finding to report to the healthcare provider. The APTT is within normal limits, and the hemoglobin is lower than value for an adult female, but within normal limits for a pregnant female. Although the platelet level is slightly low and may impact blood clotting when compared to renal failure, it is less important. A client presents to the OB triage unit with a report of bright red vaginal bleeding that has saturated a peripad over the last hour. The nurse observed the fetal heart rate with a baseline of 130 decreasing to 100 for 60 seconds and then returning to 130. There are no contractions present. Which of the priority nursing interventions? 1. Ask client time of last oral intake and prepare to start an IV. 2. Continue to observe, monitor, and perform Leopold's maneuver. 3. Apply oxygen by face mask and perform sterile vaginal exam. 4. Place client in hands and knees position and call primary healthcare provider. The correct answer is 1. Because the woman is currently bleeding and the fetal heart rate is showing decelerations, the woman would need fluid replacement and a possible emergent cesarean birth. The woman may also need fluid volume replacement. The nurse can prepare for this by asking last oral intake, obtaining IV access. The client should be placed in a lateral position to enhance uteroplacental blood flow and given oxygen. The nurse should notify the primary healthcare provider as soon as possible, but the hands and knees position is indicated only if the client is experiencing back labor or umbilical cord prolapse. Leopold maneuver is done to determine fetal position in utero and would have already been done prior to placing the fetal heart rate monitor. A client presents to the OB triage unit with no prenatal care and painless bright red vaginal bleeding. Which interventions are most indicated? 1. Applying external fetal monitor and complete physical assessment. 2. Applying external fetal monitor and perform sterile vaginal exam. 3. Obtaining a fundal height physical assessment on the patient. 4. Obtaining fundal height and a sterile vaginal exam. The correct answer is 1. Bright red vaginal bleeding without contractions could indicate a placenta previa. A sterile vaginal exam should never be done on a woman with a known or suspected placenta previa. Applying the external fetal monitor will allow the nurse to assess fetal status. A complete physical assessment of the patient is indicated. A fundal height is used to monitor fetal growth during pregnancy, but does not provide information related to vaginal bleeding. After instructing a multigravida client at 10 weeks gestation diagnosed with chronic hypertension about the need for frequent prenatal visits, the nurse determines that the instructions have been successful when the client states which of the following? 1. I may develop hyperthyroidism because of my high blood pressure. 2. I need close monitoring because I may have a small for gestational age infant. 3. It's possible that I will have excess amniotic fluid and may need a cesarean section. 4. I may develop placenta accreta, so I need to keep my clinic appointments. The correct answer is 2. Women with chronic hypertension during pregnancy are at risk for complications such as preeclampsia, about 25%, abruptio placentae, and intrauterine growth retardation, resulting in a small for gestational age infant. There is no association between chronic hypertension and hyperthyroidism. Pregnant women with chronic hypertension are not at an increased risk for hydramnios, an abnormally large amount of amniotic fluid. Clients with diabetes and multiple gestations are at risk for this condition. Placenta accreta, a rare placental abnormality, refers to a condition in which the placenta abnormally adheres to the uterine lining. It is not associated with chronic hypertension.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.